Ladies and gentlemen, Malabai to Malabresses, my dear listeners, far and wide. It is 32 minutes past the hour 2, and I'm here today, but I have very special and amazing guests with me today. You tuned into Unico Radio 103.5 FM with your favorite host, Glory Praise, but you can also call me SpongeBob or Baby Pharaoh. Whatever you like, I will be that for you today. We have very special, informative radio session today. I know, yes, I don't want to give you all the tea yet because when I come back, it will be more of a mind-blowing experience for you. So sit tight. I'll be right back after the short musical break. But yes, today is about something very amazing. And amazing thing about this is not just a day. Yes, that's what. So I don't know who can guess what it is, but yes, we are here today in commemoration of World Immunization Week 2025. We have a panel of esteemed guests joining us to discuss this crucial topic. I know when I use the word crucial, a lot of you would think, why is it crucial? But I think we all know immunization right from birth is very important because yes, we hear that don't immunize your child, you're introducing drugs to your child, but we also know that without immunization, you are opening your child to a lot of infection. You're opening your child to a lot of diseases which could have easily been prevented by just one shot or a series of shots since it's a child. And on today's panel, we have Dr. Veval Okoreze, the president of iMedic-led. Dr. Veval, thank you for joining us today. We have Mrs. Cassie A. Young, the director of disease control and immunization at Cross River State Primary Healthcare Development Agency. Welcome, Mrs. Cassie.
Thank you.
Yes, and we have Miss Favor Ekpang, the president of CRIMSA. Miss Favor, welcome.
Thank you very much.
And then we have Dr. Ayamba, a medical officer at UCTH.
Thank you.
Okay, you're all welcome. But I also want to state that iMedLeg, the organization behind today's World Immunization Week radio session, is an NGO founded by Dr. Veval Okoreze. And this organization was founded during her time as a medical student at the University of Calabar. I know we always talk about the Malabitic spirit. So yes, this NGO is founded with a tight Malabitic spirit, definitely.
Yeah.
And this organization started as Let's Discuss Quiz in 2018, but it has grown from a local initiative to hosting national events for medical students. And it's beyond just the normal health awareness and the wellness of health. iMedLec is beyond that. It also fosters academic excellence, skills, and talent through reward system. I know every one of us loves reward system, so why not tune in and be with iMedLec? And it also has a core focus on education, health, and access to medical and general health information. Now it is known as iMedLec, but when it started, it was Let's Discuss Quiz. So it's no longer Let's Discuss Quiz. It's now known as iMedLec, and the organization under Dr. Okoreze's leadership is bringing us to this important discussion on immunization today. So right now, Dr. Veval, I'm coming to you because you are our CEO and the organization of today's radio session. What is the theme of this year World Immunization Week, and why is this theme chosen?
Okay, thank you very much once again for having me, and I would say it's really an honor to be here. So for this year, we are commemorating and celebrating the Immunization Week, and as well creating the awareness, because like our aim is at iMedic-led, we're motivated individuals who are poised at changing the narrative by creating a reward system for academic excellence, skills like you said, and building a community with access to emphasis on accurate and reliable health information. Because yes, we have health information out there, but we need something specific so people know what they are doing. So for this year's World Immunization theme and why it was chosen, our theme for this year is humanly possible immunization for all.
Wow.
Now, it highlights the importance of vaccines, the power to protect everybody, everyone from life-threatening diseases, and it also emphasizes on the collective action and progress available when communities, health system, government, everybody puts their hands together to
Yes.
get immunization. And like you said, when you opening statement, you were saying children, children, children. It would surprise you that immunization is for the children, for the young adults, and even for the elderly. Yeah, so
Yes.
it covers
Everybody.
everybody.
That's
Thank
why
you.
humanly possible. As long as you're
Yeah,
human, you need
immunization
to be.
for
Yes,
all. Thank
immunization for
you.
all. Okay, Mrs. Cassie, I want to ask the importance of immunization today, especially after the COVID-19 pandemic. Because a lot of people are like, oh, the COVID-19 pandemic immunization could not protect us. But we still know that there is an importance to immunization.
Okay, thank you very much for that question. All of us know that immunization still remains the best and the most important way of preventing diseases. Any other way can just be by the side, but I want to tell us that immunization remains still the best. And just like we've heard, it's very important to all of us, to parents, to mothers. It prevents all deadly diseases, and this is the only way to prevent all diseases from our members and other people in the community.
Yes,
Thank you.
yes, that's so amazing. So it prevents all diseases. Be immunized. That's it, the important. I know we have pandemics, we have health outbreaks, but still, it does not stop the importance of being immunized. Miss Favor, I also want to ask because I know in every field of work there are common myths, there are common disassociations, especially with myths. So, what are the myths about vaccines that you would like to correct?
Okay, thank you very much for that question. By me, there are a lot of things that people are worried about immunization. You hear people say, immunization is harmful. It will cause that disease that they are trying to prevent, especially during the COVID-19 pandemic. People were like, this vaccine might actually give me COVID, but that's not true. Vaccines are not harmful in the sense that they contain inactivated parts of those organisms or weakened part of those organisms. So you are not and they are in a form that cannot actually cause disease. So do we get? So that means for every vaccine, it's given in a particular amount that is not harmful. So vaccines are not harmful. So that's one of the myths. And then another
Yes.
common myth we have is that vaccines can cause mental disorders, which is
Okay.
not true. I think the common one was that vaccine causes autism.
Wow, wow.
Yes, we heard that vaccine causes autism, and people are really worried about it. Parents don't want to give their children because they don't want their children to come down with any mental disorders. But there are studies that have shown that this is actually not true. Vaccines don't cause any mental disorder.
So yes, we've heard that vaccines do not cause any mental disorder. So this information, take it far and wide, even to the villages. Let them know that every child, everybody, not just children, needs to be vaccinated. And also, how do vaccine contribute to building stronger health systems in the communities and at large? Yeah, because we know that vaccines will help definitely. Because if you're always having lots of sick children while in the hospital, so we definitely know that vaccines help. So how do they do this? How did it come about?
Okay, thank you very much for this question. Vaccines, like we know, help prevent illnesses. We have several diseases in which children are vaccinated for. And when children get vaccinated, they build this immunity against certain diseases. So when they come in contact with those microorganisms, those causative agents for those various diseases, they already have immunity against those diseases. So coming in contact with those causative agents will not allow them to, because they already have that immunity, they won't come down with that disease. So vaccination help prevent disease in the society. When you see that fewer people come down with sicknesses in the society, the healthcare system is already saved from a lot of stress and casualty. It also
Yes.
prevents fewer hospital admission. It also improves school attendance for children, because if children are always coming down with one disease or the other, measles, rubella, diarrhea, because they were not vaccinated, they will not be studying in school and they will not be effective in their academics.
Yes.
So that's another important reason why you should allow your child to be vaccinated. Also, it saves your finances because you will not be going to the hospital and spending money for several diseases. So
Yes.
this would help us if we are allowing our children to be vaccinated. Thank you.
Okay, that is wonderful. So, yes, every parent, everybody, even as an adult, make it a point of duty to get vaccinated. You know, a lot of people say, "Oh, I did not know, I did not hear." But then we have iMedLed that is going to tell you all the kind of vaccinations you need, where you can get them from, like in your community. It could be your health center, it could be a hospital, it could even be a pharmacy. That's why we have iMedLec here. And then what are the vaccines that are currently recommended for children, adults, and even the elderly? Yeah.
Okay.
Okay, so for the children, there are several vaccines that are recommended. We have the BCG, which is for tuberculosis. We have the polio vaccine. We have hepatitis B vaccine. We have vaccine for measles, rubella, mumps, and even pneumococcal vaccine. Also, recently, there's also an advocacy for the malaria vaccine also for children. So all these vaccines help to ensure that the child is protected from those diseases when they come in contact with the causative agents. For adults, we have tetanus, we have hepatitis B, and also recently the human papilloma vaccine has been introduced for the young ladies to prevent cervical cancer. And also we have COVID-19 boosters too. For the elderly people, we have vaccine for flu, we have vaccine for shingles, and also pneumococcal vaccine for them. So vaccine is for everybody, not just children. For the adults, for the elderly, and also the children. Thank you.
Okay. But also in this line, we want to focus more like locally and national. That's where we want to bring down our knowledge to. How do you describe the current immunization coverage in our country?
Okay, let me take that. Let me just take that briefly. I think that's why we're here. And like Emma declared, had a sub team where we talk on breaking barriers. And Nigeria falling under developing countries, it's actually important that we get immunized and we get vaccinated. And for our coverage here in Nigeria, well, there've been some booster doses for children, and especially in urban areas, you see that kids have vaccine covered, not as much as the rural areas. But most of the times, what we faced more grievously in this region is the fact that adults neglect vaccinations, and they don't know that it's actually important for them. You only see cases when people are to travel out and then they start looking for how to take yellow fever and some other vaccines. But then we could prevent all of this if we can have this coverage. So, well, the coverage so far, well, it's improving, but it's still below the global standard.
Okay. And in this line also, what are the challenges we face when it comes to achieving 100% immunization in Nigeria?
Okay, thank you very much. For us to achieve that, we have a lot of challenges, though for Cross River State, we are doing very well. Like I can tell you, I can beat my chest on that, that we came first out of the 36 states plus Abuja.
Wonderful.
Cross River
Congratulations,
came
ma'am.
first.
Yes,
So
congratulations.
this is as a result of the proactiveness of our DG and the, when you have a good governance,
Yes.
the people, they say the people rejoice.
Yes.
And I want to use this opportunity to thank our governor. He has been very helpful to the percentage coverage we have. He releases counterpart funding during our immunization days, and that has helped us a lot. So most of those challenges we still have. We have challenges, geographical challenges, like we have hard to reach areas, we have riverine areas, mountainous areas, the terrain of Cross River, how it is. That's one of our challenges. And we also have our supply, that is vaccine supply chain issues, where all our equipment cannot reach everywhere. We have 1,040 facilities offering routine immunization, but nationally we were only supplied with 320 coaching equipment. And because of that, we still have the gaps that we need to fill. We also have challenges of financial barriers, especially in the hard to reach areas, where mothers will not want to forsake their daily farming to take the children to vaccination. So those are some of our problems. I can mention them on and on. There are also, there's this one important one that we did of recent, the big catch-up campaign. That came as a result of us not being able to meet up with children 2 to 59 months who had missed or had not completed their vaccination. So with that, we've been trying to see how we can meet up with all children being vaccinated. But I can tell you that the whole of Nigeria, we became first as a state, and we are planning to do better with a coverage of 95%. You can Google it, you can see it in the geographic health information. That's where the information is gotten from. And you can see that Cross River is doing well, but we want to do better. Thank you very much.
Yes. Okay, we will have to come down to more of the public engagement because we've gone through local and our challenges here. So, how do parents ensure that their children are up to date with all necessary vaccines?
Okay, we'll start with birth. So, first of all, when your child is born, you receive an immunization card. So, as a parent, ensure that your child from birth receives the necessary immunization, because there are certain immunizations that are given at birth. There are immunizations given 6 weeks, at 10 weeks, at 14 weeks. Then we also have immunization given at 9 months of life, and at 12 months. We also have at 15 months and at 18 months. So it's all available, the information is all available in the card. So all you need to do is avail for those appointments, get your child vaccinated. And then for adults, we have a lot of public healthcare centers around which you can go to for information, because that's the basic thing. If you have the right information, you'll be able to follow up with your vaccination.
Yeah.
So get the right information from the right points, from the right centers.
Okay. As it is said, it takes a village to raise a child. So, what roles can schools, religious institutions, workplaces play in promoting immunization?
Okay, thank you very much. So for schools, there's a whole lot the school can do to ensure that children go for vaccination more often than it's happening now. One thing they can do is creating awareness, especially amongst the parents. Encouraging the parents to ensure that their children are taken for their scheduled vaccination. That will really help to ensure that more children are immunized. Also, they can organize outreaches where the children, health workers are invited to give the children some vaccines that have not been given to them. Also, they can volunteer their environment, their compound, and say, okay, in case you want to do any vaccination in this community, you can come and have it here in our school compound. That would also help, because the children are already there. Because one hindrance, like you said, and like one of us has said, is that parents don't like to leave their work to go to the hospital. So if it is brought to the school, it will be easier for the children to be vaccinated without much hitch. For religious organizations, creating awareness and also encouraging their members will also go a long way. Like we know, Africans are very religious people, so they tend to really take seriously what their religious leaders say. So if our religious leaders are encouraging and also emphasizing on this, it will go a long way to help.
Okay. And yes, this also boils down to one of the common myths about vaccines ruining children's life, giving them health. So how do we know that vaccines are safe? How are they tested before introduced into the public?
Well, like Dr. Ayamba had said earlier on, what people should know, I think it's part of the misinformation that makes people afraid. And that's why we're here, to actually give you reliable, I emphasized on something earlier on, reliable
and accurate
health information. So you should know that vaccines go through a rigorous testing in multiple phases, from laboratory research to large-scale clinical trials. After approval, they continue to be monitored for safety. And you should also know that side effects are very rare and very mild when it comes, if it comes at all. So vaccines are safe. And when you think of, because as a doctor, as a practicing doctor, you see people coming down with hepatitis that's there's really no cure.
Yes.
You understand? It's even more crazy than HIV, if you ask me.
Yes.
And there are things that could have been avoided by just
Yeah.
being vaccinated.
Yes.
And then a woman goes through delivery and hasn't had tetanus injection, or you have an injury and all of that, these are actually the importance of these things, and it could just save you from a whole lot of health challenges. So the misinformation should spread across board. While people have the right information, you see that it would help them know that, okay, these things are safe, and you don't think it's the Antichrist. I think when COVID came,
Yes, yes. Like she
It was
said,
true.
it also boils down to, because we love religion. So
Yeah.
if our churches are telling parents, take out this time,
Yeah.
okay, fine. Even if they cannot say, okay, take out this time, make space in church. Like we see lots of churches do medical outreach, which is
Yeah.
really, really amazing, because
Cool.
parents will definitely turn up in church on Sundays or during midweek services. So it's really, really amazing. And then for the future of immunization, because we've had the past, we had the present, and we will always look towards the future. Are there new vaccines currently, like that recently introduced or coming soon, that the public should be aware of?
Okay, thank you very much for that.
Yeah.
I'm just happy because there was a day somebody asked me, why children, what of the adults? And I was just very surprised that people can be this wonderful. So we are going to have measles, rubella.
Yes.
It's coming up soon, and malaria vaccines. So I'm sure by the end of the year we'll be introducing those vaccines. But I want to use this opportunity to enlighten or also spread the news of the campaign we are having at hand. For now, we've been on preparations for the upcoming Immunization Plus Day that will be coming up on Saturday from the 3rd of May to 6th of May. So all parents, since schools are on, most schools will be on holidays, we are telling or trying to inform you that health workers will be moving house to house to make sure your children are vaccinated and are well protected. So please, we want to use this opportunity to beg that as they come in, allow your children to be vaccinated. Yes, Nigeria is polio free. We have been certified polio free.
Yeah.
But we have countries around us, surrounding us, who are still not certified free. So please, as they are coming to vaccinate your children, just 2 drops are okay to protect your children from being exposed or having such diseases. Also, for the state, we are going to have like for children who, let me say young children that had not taken this human papilloma virus vaccine, we are going to intensification by May. We'll be vaccinating children maybe 9 years. For girls that were not up to 9 years when that vaccine was introduced. And I want to use this opportunity to beg. Our coverage for HPV is very low.
Yes.
So it shows that it's exposing our girls to having cervical cancer. So please bring out your children. Nobody will give your child. Some of them say these family planning pills, they are trying to reduce or cut down in population explosion. But I want to tell you that it's a big lie. Please bring out your girl child to be vaccinated. And the age for now is 9 years. Last year it was 9 to 14 years, but as of 2025 is 9 years. So make your girl child available and prevent your child from coming down with cervical cancer.
Okay. Miss Bevel, Dr. Bevel. Yes, I also have to ask, because you are more in the tech part of medicine. Yes. So how is technology helping improve vaccinations, delivery, and tracking these vaccines to make sure they get to the communities, they are taken and they are accounted for?
So the I in the medic
Yes.
is the tech part here. And if we look at technology, there are now digital tracking records available. I tell people there's the social media era and people are using computer to ensure. And with my communication, even for example, the DG Primary Healthcare for Cross River State, she told me about like the drones they have. I'm also an immunization champion for the states as well. I'm one of them, and she's our team lead here. So we have drones available that help drop this immunization in remote centers, and also a real-time cold chain monitoring where you have these things being monitored, and it helps the vaccine program get better. And like I tell people, the future look for this? Because there are new vaccines that are coming up. They're working on HIV vaccine, yeah,
Yes.
dengue finger, and as well universal flu. So by the time all of this has been done, technology is taking the medical field now to a whole new level.
Yes.
And then we also have the web space to share this information and ensure that things are properly recorded and tracked. So
Yes.
we're going into a generation where we would have a lot of disease in extinct because of vaccination.
Okay. In regards to global efforts, what can we expect in the future that will aid to eliminate vaccine preventable diseases and, also aid the people to be aware of these diseases?
Okay, so global bodies are aiming to eliminate certain diseases like polio, just like one of our speakers said. Nigeria has been declared polio free, so other countries are also working towards it. So through mass vaccination, just like she said, the health workers will be moving around from the 3rd to 6th of May. So that's one effort that has been done, mass vaccination, where health workers go house to house to ensure that there's vaccination for those who might not want to leave their houses to go to the hospital. Also, continued investment in innovation. Just like we talk about tech, all these are strategies to ensure that there are improved response to vaccination. Also, we are working towards equitable access to ensure that even in the rural and interior areas, vaccination or vaccines could get to them. Thank you.
So let me add to that.
Yes.
We'll also, when we speak of vaccination in the rural areas, if you don't carry the people along, you are lost.
Yes.
So we are going to have collaboration with the traditional rulers
Yes.
and the community leaders. Also with the religious leaders, we are holding meetings with them, regular meetings with them. So how do we go about that? We involve them in the activities. For every activities we carry out, we use them as most of the mobilizers. We use them as the community leaders because when some of them see the health workers, they say they don't know them. But when you see your community leader as part of the team members, you have no option than to give up. So that is one major aspect of it. Also, with the use of the drone, just like she said, innovation of vaccine delivery, like in Obudu Cattle Ranch, where let's say now is Obanliku, where we have the Becheve. The Becheve area cannot be Belekete cannot be easily accessed by leg. It's even easier to access it by Cameroon. So, but with the use of the drones, they go in there, drop vaccines as planned, and we are happy our children are immunized. So those are some of the issues, how we can solve those problems. And also pluses, that's one thing that attracts them. When we go to those rural communities and bring out pluses, it's like a bell is everybody is rushing to come and be part of it. So those are areas of most of the things we can use to get them vaccinated.
Okay. What message would you like to leave to today's listeners regarding importance of vaccine?
Okay, so this goes to everybody because I thank God for the link. It's going globally as well. What we need to know is vaccine saves life.
Yes.
It's very important.
Very.
They're one of the most powerful tools we have to protect our families, our communities, and the future generation. Let's stay informed, let's trust science, and let's ensure that no one is left behind. And I'd like to add, iMedicled is here to give you as much accurate and reliable health information as you can get.
Yes.
So do well to follow us on our social media handles at iMedicled organization, iMedicled on Instagram, X, and we have a website www.imedicled.com. So thank you. Thank you so much.
Okay, to my amazing listeners, this is a special interview with special women, amazing women, Dr. Vevel, Mrs. Cassie, Dr. Joy, and Miss Favor. It's really a privilege sitting amongst When I say important, I mean important women. It is really a privilege because in their field, they are amazing. In their field, they are the ones that bring us this accurate information. They are the ones that tell us that this is the right thing we should do. And also, this program is a call to action. This program is a wake-up call to all parents, especially our mothers, because yes, a lot of African fathers, they don't know, oh, I'm supposed to take my child to so this is especially the mothers. Let's take your children to the hospital. Protect your girl child. Allow her take the immunization. It is good for her health. Take her to the doctor. A girl child is never too small to visit the doctor. A child is never too small to visit a doctor. And yes, as the theme of this year's Immunization Week says, immunization for all is humanly possible and a cornerstone of public health. So do not hesitate to reach out to your healthcare providers like iMedClear to learn accurate and more information and to ensure that you and your loved ones are protected. Vaccination is an act of care for ourselves and our wider community. I will take that again. Vaccination na act of care for ourselves, our mama, our papa, our pikin and people wey dey surround us. Thank you for listening to this important session on Unico Radio 103.5 FM. I'm Agbo Glory Praise. Stay safe and stay informed. Thank you.
Thank you.